Hello and welcome to SCAN. SCAN stands for Social Community Activities Network. I'm really excited to be here today. I haven't sat in this seat in a few months, but again, SCAN is a nonprofit agency dedicated to helping active adults stay informed, empowered, and inspired. And I truly am pleased to be here. And we have two fabulous guests with us today representing a state organization that we are now working with very closely. Before we get into a lot of the information that we're going to be sharing with you, I just wanted to give you a heads up that at the end of this show, we're going to be posting some information where you might be able to access some of the programs that we're talking about today. So please make sure that you have your pencil and paper in hand, that you can take down that information. I really would like to take this opportunity to welcome Amanda Medina-Forrester from the Department of Health, and also Lisa Asare in regards to the Department of Health, and they're going to tell you what divisions they're working with and specifically how they come to our table today. So we'll start with you, Amanda. Tell us how you got here.
Sure. So again, my name is Amanda Medina-Forrester. I'm with the Office of Minority and Multicultural Health under Integrated Health Division at the New Jersey Department of Health. I'm fairly new. I am 3 months in the position, so I'm fairly new. I came to the position, I was once a coordinator, chronic disease coordinator for Hunterdon and Mercer counties. Okay. And so that's how I got this position. And my background is public health. I've been doing public health for a very long time, since 2001. Got my master's in psychology and my public health degree, so this is something that was a perfect fit for me, and also a passion. Health disparities is a passion.
Well, again, and we're going to talk a lot more about health disparities and how that affects all populations, and specifically we'll talk a little more about senior issues. So welcome, and I'm glad that you're in your new position and that we get to work with you.
Thank you so much.
And so Lisa, how do you come to our table?
Good morning, and thanks for having me. My name is Lisa Asare. I'm the Assistant Commissioner of the Division of Family Health Services within the Department of Health. Within Family Health Services, we are there to really help people improve their health and really reach optimal health. We have several programs, including the WIC program, Maternal Child Health, and Special Child Health and Early Intervention Systems. Unlike Amanda, I've been there for a long time. I've been there for 20 years.
Wow.
In various capacities in the department, and really focused on addressing health equity and reducing disparities.
So my first introduction to the Department of Health is when I was the association manager of the 21 area agencies on aging in New Jersey, and so I used to sit at the table when aging was under the Department of Health, and so we had lots of conversations there. They're no longer there, but the affiliation is just really important, because keeping everyone healthy is important, but also we are looking at seniors' health here specifically. And that's one of the programs that you just funded us for, and we're extremely happy. Again, it's the first time that we're working with the state on health issues. We're a certified evidence-based program for diabetes self-management and take control of your health, which is a 6-week program that's scripted. Yeah. And then we were knowing the population and knowing some of the challenges in evidence-based programming, because asking someone to show up for 6 weeks in a row and putting it on their calendar always seems to have been a challenge when we look back and look at the numbers. But we added the plus, and I think the plus got us funded, number one, but happy to tell you that the plus is really working well in the field and with the seniors. So for the audience, I just wanted to share diabetes self-management is a scripted program, so we can't deviate from the script, which is fine. It's always led by 2 people, which is 2 peer leaders. And the plus is that we have added an exercise nutrition education piece to the training after the script. And that's really going over well. And the other obstacles for people coming to evidence-based program is usually transportation, like they can't get there. So we are able to help them get there with transportation. So that's part of the plus. And then the other is that we're able to provide a gift card after the 6 weeks so they can go buy healthy food.
Oh, nice.
And practice what they've learned. So because of you and your divisions and your department, we've been able to do that and bring it to Monmouth and Ocean County. So on behalf of the seniors here, we want to thank you. Now, with that said, let's talk about the programs that you're doing specifically. So if you want to maybe start and give us an overview,
Sure.
that'd be great.
So the Office of Minority and Multicultural Health, our focus is health disparities. And health disparities is when you see a difference in one group versus another on their health outcomes. So for example, maybe children have more illnesses, more colds versus another group, maybe older adults, or health disparities on senior citizens. They're more prone to falls, hip fractures, hospitalization, loneliness, depression. There's a lot of disparities with our senior population, and that's something that our office likes to work with, and not only programmatically, but we look at data. You know that everything is driven by data in every part of our Department of Health. So we look at that as our driving force of what we should be looking and doing in a programmatic piece, such as funding your program, the DSMP. From the Stanford model. So.
Right. So data, I love it. I love it. But sometimes it's really hard to collect. And then I can only imagine the reports that you get regularly or monthly from all of the people that you fund or collect data from. We were talking prior to the show that there's like 3 divisions under the Department of Health. And so I'm sure across the board, whatever comes in is looked at closely so that you can come up with some of your funding needs or what you need to look at closer and fund in the future. Is that how it kind of works?
Yeah, Lisa could answer that one really well.
I think that's exactly how it works. We really try to use data to move from data to action.
Okay.
And I think, as Amanda mentioned, we really use data to guide our interventions. And so, for instance, we have something called Healthy New Jersey 2020, which is our state health improvement plan. And we have about 4 indicators specifically for older adults. Things like falls, things like improving the health status overall. You talked about nutrition and physical activity promotion. And so these are many of the things that we use as our benchmarks to say, are we being impactful? So once we identify where the needs are, then Amanda and myself and our teams come in to really develop programmatic initiatives that will really support the direction in which we would like to go. So 2 of the things we have in my division are the Farmers Market for seniors.
So run out of the WIC program. Market.
And we also have a program called SNAP Ed, where we give health education and physical activity promotion. And those programs are both very active in Monmouth and Ocean counties, and really programs that we're proud of.
So let's just stay on the farmers market for a minute. So some of the audience might not know it because they've not participated in the past, but it usually comes out in the spring, the program?
Yes, this is correct. It sort of it's announced in the spring and really takes full steam starting June the 1st, and it goes through the summer months and ends in September. And so seniors who are eligible, low-income seniors, are able to get vouchers, 5 of them, to purchase fresh fruits and vegetables from their local farm stands and things of that nature. We also have the Commodity Supplemental Food Program, which is called CSFP. And that comes out of food banks. So the food bank of Monmouth and Ocean County can also prepare monthly food packages for low-income or eligible seniors. So another program that is very available.
Yeah, so in Monmouth and Ocean, the food bank has changed their name probably a year ago, called Fulfill. So again, for the audience, because sometimes we just get so confused and we confuse everybody because we kind of change that. But I think the reason they had changed their name is besides doing the nutrition and helping soup kitchens and pantries, they also do a whole lot in regards to making sure people know what they're eligible for, and we'll talk about that in a little bit, but so that they have the whole picture about staying healthy and about having good access to good food. So yeah, 2 programs and 2 organizations that we love to work with, and I know that the farmers market vouchers are usually distributed by the offices on aging to local providers in the community, and they're they're the ones who distribute it to the seniors.
Yes.
And I do even think that our transportation department, the SCAT transportation, is now taking people actually to farmers markets
nice.
during the
Fantastic.
season, or certain ones, so that they can have access
That's
to
great
it.
news.
So, because we're looking at that whole piece, transportation is a huge, across the state, across the country, about people not being able to get out. So that's really, really exciting. So what other kind of programs? We talked about SEED, and that was a new one for me.
Sure. So the Department of Health funds grantees. There's 21 grantees for cancer education and early detection. And so every county, and there's actually one county that has 2 SEED programs. It stands for Cancer Education Early Detection Program, and they screen for cancers. It's cervical, prostate, breast, and colorectal. And these are free cancer screenings for people without insurance and who are underinsured, such as a high deductible.
And so we're going to provide that information.
So we will, right. So you have a provider here in Ocean County and in Monmouth County that will take individuals, residents, and and screen them, and it saves lives. It saves millions of lives to get screened. So we're always promoting our cancer screenings, all types of screenings, eye screenings for for diabetes, of course, and and glucose screenings. So it's very important that we announce this and we publicize this to our public.
So we have a really good relationship with our local Board of Health.
Nice.
And so I do know that they have eye screening in our Board of Health.
Oh, great. That's wonderful.
They've recently moved from Route 9 to the middle of Freehold, which is fabulous, so people can actually get there and access them. But we do work closely with the Department of Health. At our Senior Expo each year, and this year will be on May 10th here at the Monmouth Mall. They usually have a table so they can distribute a lot of their information in regards to the other things that they do, especially screening. So I just think that sometimes when we talk Department of Health versus Board of Health versus all of the health initiatives, it gets just so confusing.
It's very confusing.
But without you guys, we wouldn't be healthy. So we do appreciate that a lot. So just if you want to share some other things that you are doing.
Just in general, and if we speak about disparities, one of the key initiatives we're working on in the state is really looking at infant health and maternal health. Those are really key areas where we have big disparities, particularly between black and white. A child in New Jersey, a black child, is 3 times more likely of not making it to its first birthday than a white child. And pregnancy-related mortality for women also shows large disparities. So that is an initiative, maybe not for the seniors, but one that we are attacking across the state.
And that would be of incredible interest, especially to grandparents.
Absolutely.
So understanding that and what might be, what one would look for, and where they can get additional help as far as that.
We try to take a 2-gen approach. So we recognize that as much as a mother has a baby, there's often a grandmother in the house or an aunt in the house who can help with breastfeeding promotion or a safe sleep promotion. So we really try to include all segments of the family. We think it's so important.
Well, that's really exciting. So we're almost at break time. Can you imagine how fast time goes? And when we come back from our break, we will talk more specifically in regards to some of the programs that you fund in regards to seniors, and just some more general conversation, because I think this whole conversation about staying healthy, being healthy, and knowing where to go to get help to be healthy is just really important. So please stay tuned. We'll be back in a minute with our fabulous guests from the Department of Health.
So, if you're over 65, like me,
and active and fairly healthy,
being active and healthy alone will not protect you.
Remember, the immune system weakens with age.
And if you're over 65, ask your doctor about your vaccination options.
We want you to be healthy and active.
Welcome back to SCAN. I have the pleasure of talking to Amanda Medina-Forrester and Lisa Asare from the Department of Health, and we've been going through a variety of different programs that are offered through the Department of Health. So we wanted to get a little more information about the other stuff that is provided out of this massive department from the state of New Jersey, especially emergency preparedness, because as you know, we were hit very hard during Sandy in 2013, and that has been an issue and a conversation that we've been having ever since. So with that said, tell us what we should do or need to do or need to know. And the only other thing I wanted to share with you is that we do have that readiness form that we ask seniors to fill out if they live home, so that the local emergency preparedness people can absolutely find them, especially homebound seniors or people that are not feeling well.
Right. So the emergency preparedness is really important to us, and there's never ever too early to prepare. You never know what's going to happen. And so in New Jersey, the Department of Health is always ready for this. There's 5 points that they want us to share with you. We want to share with the public is number 1, go on to nj.gov. You're going to find an emergency preparedness plan and steps to take. It's really important to review that. I'll send you the information, and I think it's, you know, it's user-friendly, simple to read. It's just quick steps. Another step is you and your family come up with a plan on where you would evacuate. Make sure you have something in writing, something that is shared through text, to make sure everyone's on the same page if there is an emergency. Another piece is medications. We always forget our medications.
Absolutely.
We pack everything else. We pack our clothes, we pack everything, but we neglect our medications. Prescription, referrals, renewal prescriptions, that's really important. The 4th thing is our pets.
Big time.
We love our pets, but in an emergency and in panic mode, you kind of forget what happens with your pet. You take them, you forget their food, you forget their waters, bowls, toys, whatever.
Yeah.
Remember, they are part of the family as well. And then also the 5th thing is make sure you have copies of your birth certificates, your legal documents. Digitalize them, make sure they're on a flash drive, on something in case you don't have it on paper, but carry that with you and make sure you have a great package of this. And there's a lot more steps on nj.gov, but these are the 5 main ones that we want to relay to our community members because again, it's never too early to prepare for something.
And we have done some classes around that too and given away some kits or things that should be in those kits. But absolutely, because you never know what happens. And with all of this issue around climate change, whether you're for it or not for it, you can't tell if it's going to hit us. You wanted to add something to that?
Yeah, I just wanted to talk about I'm so happy to hear that you're doing the classes because seniors are really considered amongst our vulnerable populations.
Yes.
You know, when Sandy hit, we spent a lot of time trying to figure out where people were. Spent a lot of time working with pharmacies that would take medication to shelters because people were unable to pack medication. We needed warming stations, we needed charging stations, you know, people who have equipment that needs to kind of run effectively and efficiently. So as she said, it's never too early to plan. We've been through something big in New Jersey. We certainly have those experiences, so I'm really thrilled to hear that SCAN is really proactive and really working with seniors in this area.
Yeah, we kind of look at all of the basics, and that's a basic. I mean, it used to be something that was special, but everyone needs to have their plan. I mean, it's just common sense nowadays because you never know what happened, whether it's a storm or weather related or if it's just another emergency. So I'm happy, and we will make sure that the website is on the screen so that people can go to that regularly. The other is that this show is being aired in April, so April is a very important month for you guys. So tell us about what's happening in April at the Department of Health and what kind of events you have coming up.
So April is Minority Health Month, and that comes from our federal government. The Department of Human Resources is giving us an opportunity to make things aware of health disparities and also embrace our differences. And this is why what we do at the Department of Health. We want to encourage all our grantees, all our stakeholders to promote their differences and to share our beliefs and to feel proud of where we're coming from and who we are. And then of course also talk about why there is a difference. Why is there a difference in a health issue? Why are Black infants more likely to pass away than a white infant? You know, so I think these are discussions, and April gives that time of a safe time, a safe place to do it. The Office of Minority and Multicultural Health is hosting 2 forums. There's going to be one in the North Jersey and one in the South Jersey. The North Jersey is going to be in Montclair State University. It's going to be April 18th, and we're right now working on the agenda, getting some keynotes, and it's everybody at the Department of Health is helping out with that.
That's great.
And then in South Jersey, this is a big one. It's going to be Atlantic City Convention Center.
Wow.
And that's April 4th.
Okay.
And so that's also, and the reason why we have 2 of them, because North Jersey is different from South Jersey.
Sure.
And we want to make sure those differences are acknowledged and addressed. So we have speakers from North Jersey, speakers from South Jersey, and we have 2 excellent committees that are overseeing this, and they're external stakeholder committees. So I'm really, really honored to be part of this year. And then of course, the piece that we're going to be addressing is Black infant mortality and maternal mortality on both, because that's such a priority for all of us.
Big issue. So with that said, we have an event too, and we're excited, and you're always cordially invited. And,
Thank you.
And again, I have to tell you, having this grant, which is again new to us, has opened new doors of opportunity for us, because we really didn't work with the faith-based community that much, but now we have embraced them and vice versa. They've embraced us. Reverend Sparks, who is the pastor of Bethany AME Church in Freehold, is now on our board of directors. And again, the communities that we're getting access to, we never had or could in the past. And so we're just really excited to make some new friends and to bring all of our stuff to them.
I'm thrilled to hear that, because I think what we're seeing in the health equity realm, to do this work, we have to work with all partners.
Yes.
And so what we're seeing in health is we have to work with non-health partners, because we recognize that to be healthy, you have to be well in all the areas. So I'm thrilled to hear you're working with the faith-based community. We're working with schools. We work with transportation. We work with education. We work with human services. I mean, when you have a discussion about health, the table is very diverse.
Yeah.
And so I think that that's sort of the direction we're going in. So it's wonderful to be here with you as you work with seniors to really talk about how we can partner together effectively and bring in some of those non-traditional partners, particularly the faith-based community.
Yeah, so our event, which is April 5th, it's a multicultural, multi-intergenerational, big mouthful, in regards to the event that we're going to have. And it's new for us. I mean, we're partnering with the VNA and the church, and we have a relationship with the YMCA, and we have a relationship with your SNAP group.
SNAP, yes. SNAP is the food stamp program.
Yes.
But they also have an initiative that does education. And so we at Family Health Services are the SNAP Ed implementing partner. So we do food demos, cooking classes, physical activity promotion. And I know we're very active in Monmouth and Ocean counties.
So they're all part of this whole day. And then we, and the food that we'll be serving is multicultural, but it's being prepared by the students from the local high school. They have a culinary school. So it's kind of a little bit of everything. So hopefully you'll come. If you don't, we'll probably videotape some of it that you might be able to see it. But it's our first. So we're just really excited to be able to do that.
Yeah,
and
congratulations.
Embrace that.
Yeah, very diverse we are in this state. And so really wonderful to see these type of multicultural, multi-generational events going on.
And again, the partners, especially in Freehold Borough. And again, when you look at Monmouth County, there's geographic locations that are in need, more need than others. Excuse me. And we have a relationship in the Bayshore area because looking at the devastation from Sandy, but also limited income seniors have lived there forever, and they want to go back, and they need services and education, and we're doing really well there. We have developed a relationship in Asbury Park with the Salvation Army, so we use their facility to do all of this training. And again, and St. Augustine's Church in Asbury Park too will be doing Diabetes Self-Management Plus.
Oh, nice.
So yeah, so we're just kind of getting all over the place, and we will be doing something with caregivers, and that's our other, in our grant, we have 2 focuses. One is for caregivers who either have diabetes or take care of someone with diabetes or pre-diabetic, and they can't get out. So we've already even arranged for respite care for their loved ones if they want to come to the training.
That's great. That's what, caregivers have been neglected, so I'm so glad that you're really
Yeah, so we work
focus
with the
on this.
Caregiver Volunteers of Central Jersey. That's a whole not-for-profit, and they're both in Monmouth and Ocean now. So yeah, we're kind of opening those doors and going behind the scenes, saying, so why can't people help, and see if we can come up with solutions. We're really very non-traditional here, and so when someone says you can't do it, we didn't do it, or why do you want to do it, we just says, oh, we can do that.
We can do that.
That's wonderful. I love that attitude.
That's the way. That's the way to get things done.
Yeah, so it's caused some friction sometimes, but so be it. We're really fine. But anyway, again, I'm really pleased that you've been able to come here from Trenton to share this with us. We will air this in April, and we'll make sure that we send you our show that you can show it to the state.
Absolutely.
We're also aired
Thank
on New Jersey On Air, which is a streaming TV show, and this will be seen on that statewide.
New Jersey On Air.
So we're excited that you're here.
Thank
we
you.
have one more minute, so any closing remarks for both of you?
Thank you for having us.
Okay.
Thank you for highlighting this topic. You know, we think it's important. What we do, we can't do by ourselves.
Right.
We really rely on partners like SCAN and partners like you to help us do this work. So thank you very much for having us.
Right, and I agree, and thank you for highlighting the Health Disparities and Minority Health Month. You know, it's so important to us, and what you do, of course, your luncheon, your diabetes program, the caregivers program, the plus piece of the diabetes, all these pieces are so important. And so us as the Department of Health are very fortunate and honored to have you guys as our grantee.
And again, we're pleased to be with you, and we'd be more than happy to talk to anybody if you want us to go tell them what we're doing.
Wonderful.
So please.
Thank you.
So again, I'm pleased to be in this chair. I haven't been here for a couple of months, but I'm inviting you all to come to SCAN. We're located in the Monmouth Mall in the basement. Take a tour. Come take one of our classes to see if you like it. Become part of the SCAN family. Please visit our website, which is scannj.com, to find out all of the stuff that we're doing in 2019. Again, on behalf of my guests, thank you. On behalf of my staff, who we couldn't do any of this stuff without, and especially our TV production class and our fabulous TV director, I thank you for this opportunity. Have a great day.